Hello my friends, welcome back. Thank you to those viewers who asked me for hamstring self-massage. A little tricky because it's on the back side of the body, but we can totally do it. A lot of people experience hamstring pain, tightness, injuries, sprinters, runners, big time, dancers, even yogis who tend to overstretch, even just walking. And also just sitting at a computer for long periods of time can get them really tight. They're in a shortened position, they don't get fresh blood and oxygen, you're just sitting on them, so that can really cause some problems. I like to lie face up to massage hamstrings. I find that that's a nice comfortable way to relax the body as much as possible and get some good control over the musculature. So come lie face up with me. Get comfortable. Bend your knees, put your feet flat on the floor if that feels good. Usually that's nice on the low back. You can also have a pillow or bolster or something under your knees if you want to just relax your feet down. Take a nice deep breath into the belly. Exhale, come into your body. Get a little mindful, a little present. Get ready to take a few minutes for yourself. You deserve it. Allow this to be your time. And now our hamstrings go from just below the knee all the way up and connect at the ischial tuberosity, which is the sit bone. So we're going to start just at the knee crease, and I'm just going to squeeze. You can take your fingers, interlace them like this and squeeze, or you can just squeeze with your two hands separate. And I'm squeezing out. So it's like I want to pull the hamstrings off the femur, just to warm them up, and work your way from the knee crease down towards the sit bone. So I'm pulling. If you want to get a good grasp on the tissue, bend your knee a lot, that'll slacken it. And now if you have very hairy legs, you may want to use a tiny bit of lotion or cream, moisturizer, just so that it's a little easier to have some glide or to move over the skin, but you don't want too much. Be careful, because we want to really work the fascia. We want to move the tissue inside. We don't want to go sliding, slipping over the skin. So just a little bit, all the way down here, all the way to the sit bone. Excellent. We're going to do a little myofascial release. You can take fingers like this, 4 fingers on each side, and get behind like this. You can take soft fists, so I'm sort of using my soft knuckles here behind. That works too. So you're going to start again from the knee crease, slacken the tissue by bending the knee a bit, and then you're just going to let gravity take it down. Breathing, you're not pushing, forcing, pulling, but you're letting the tissue relax and move you down towards the sit bone. And now when you get to a particular point, you may want to switch and turn. So switch from doing this to doing this, which can be more comfortable for some bodies. I'm just using soft knuckles. My hands are relaxed, and I'm just sort of leaning my pressure, letting gravity take it down. Feels really good. Notice where it feels good. Notice where there's some discomfort or any particular tension or sore spots. You might want to come back to that later and work it more. And you use as much pressure as feels good to you. It's okay to be on the edge. It's okay to have a little discomfort if that discomfort is just muscle talking to you a little bit just because it's getting worked out. That's fine. You don't want anything sharp or shooting or stabbing or tingly or numb or anything like that. That you want to avoid. And if you are having those sensations, you probably want to see a doctor just in case to get it checked out. But a little bit of discomfort's fine. We're going to repeat the same thing, but this time we're going to be active with the leg. So we're going to extend the knee and flex the knee. And as you go up, as you extend, you'll feel the tissue stretch under your hands, and then slacken stretch. And you see here, that's where I like to change my direction so that I'm going down here, because it's just better on my arms and shoulders. But you do what's good for you. And stretch. Now when you get to the sit bone, let's stop here and do a little multi-directional friction. So friction just means I'm not rubbing over the skin, I'm actually moving the tissue. You can see me moving it, right? So multi-directional, obviously, is all different directions. You could also do circular. I'm just doing it here to show you. But so right on that sit bone, if you can feel, it's usually pretty prominent, but if you can't feel it, you can imagine where it is. And just different directions. It might be a little bit tender, that's very common. So just go easy. Move that tendon around, move those tendons that attach to it, those hamstring tendons. It's nice to sort of get blood flowing to that area, get some nutrients, get some oxygen, get some movement. Very nice. And now we're going to rotate the hip. So we're rotating the femur, the head of the femur, in the acetabulum or the socket. It's a ball and socket. Rotate it out. So we're externally rotating. The knee is out and the foot comes across the body. And from there, go ahead and get behind the knee again. And now we're going to work the lateral hamstrings, the outside hamstrings. So in this position, we have good access to that. And then from there, you can start bending and straightening the leg. And you can see here, because it's a more narrow area, when we were neutral, we covered the whole back of the leg. Here, it's a little more narrow, so I actually have my fingers like this, meeting together in the middle. But you can play around with it. You find what feels good. The idea, though, is that you want your shoulders and arms to relax as much as possible. You don't want them to get all tense. So keeping it externally rotated. You see my foot is crossing over my other leg. That's because of the rotation. And again, all the way down to where it connects at the ischial tuberosity. Now remember to breathe. It's sometimes when you feel discomfort or you're trying really hard to figure out how to massage it the right way, you stop breathing. But you'll hold your breath. Obviously you won't stop breathing, that would be terrible, but you hold your breath sometimes. So really focus on taking nice, deep, long breaths. Now we're going to medially rotate it. So that's turning it the other way. The knee will go in, the foot will go out. Okay, and you get those medial hamstrings. And we start. And if this is too intense for you, doing the bend and stretch, don't do it. Skip it. Just have your leg neutral normally and just do it that way until you can work up to a point where this is more comfortable for you. Breathing deep breaths in through the nose. And long exhales out. Great. So let's just rest one foot on the other so that your leg is nice and relaxed. And we're just going to make some circles. Like we were doing the circular friction a little bit. We're just making some circles with both hands behind. And I want you to explore. Just sort of feel around the different hamstrings. Go over the tendons. Feel the bellies of the muscle. See where it feels tight, where you feel a little discomfort. And if you find a good spot, just hang out there. Just put some pressure, not too much so that it hurts, but just enough so that it's maybe on the edge. And take some nice deep breaths right into it, thinking of sending healing energy and nutrients and oxygen and blood flow, everything to that spot with the inhale. And then with the outhale, the exhale, think about releasing all the tension, all the ache, releasing everything out, just dissipating into the air, gone forever. And that should feel really nice to relax those points that haven't gotten attention in a long time. And then when you feel like it's nicely released, go ahead and explore some more. Find any spots left over after our active myofascial release that are still saying, what about me? The whole line, so from the knee all the way to the sit bone. Just finding your spot. Hanging out. Deep breath in. Nutrients, oxygen, healing, and long breath out. Let it relax more. Let it feel good. And one more time, squeezing, kneading. This time you can actually even knead it like you're kneading dough. I'm moving my hands around, not just squeezing, but just big kneading massage on the whole section, the whole back of the leg here. Letting it relax, letting it go. Again, you can put your foot on your other knee if that's more comfortable for you, then you don't have to hold it up. Great, and we're going to end with giving it a little stretch. So you're going to just straighten your knee all the way. If you want extra stretch, flex the foot if you need some more. And that's great. That's a great thing to work towards getting the knee straight and the ankle flexed. And then just gently take the leg, gently, and pull it towards you. Just guide it a little bit towards you. I've got my foot flexed. And you grab it wherever it's comfortable. Some people can grab their calves, some people can grab their foot and their toes. I'm not quite that flexible, at least in hamstrings. And just hold and breathe. Breathe into that stretch, let it elongate, let it release. You can do some ankle rolls too if that feels good. While you're up there, that can help with the letting go. I think I'll do that. And see if on your exhales, it doesn't drop a little more towards your nose. And then let's specifically stretch the medial and lateral hamstring. So again, rotate that leg outwards, knee goes out, but this time you're gonna have a straight leg. And again, with the straight leg and the leg turned out, externally rotated, now give it a nice stretch towards the face. A few deep breaths here. You can roll the ankle, wiggle the toes, make sure everything's relaxed. Flex the foot for some more. And then of course our one more direction, we're going to medially rotate. So your knee is going to turn in towards your other leg. And you might find that one direction you have more flexibility than the other. That's not uncommon. We're often stronger on one side, more flexible on one side. You can roll the ankle, wiggle the toes, gently breathe and pull it towards your nose. And when it's nice and long and stretched, just give yourself a brush off. And now is the fun part, because now you get to slowly and carefully stand up and notice how it feels to stand, and then take a few steps and notice how it feels to walk around a little bit, and really be mindful of the difference between the leg you just worked and the one that still needs to be worked. So you can go back in this video and do the other side. And let me know how this was for you. Let me know how it felt. What was the experience like? Comment below, like my video, and please subscribe to my channel. I've got loads of stuff. See you later.